Welcome to the regular meeting of the Public Health and Safety Committee for July 24th, 2024. My name is Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I will ask the clerk to call the roll to verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
We have 5 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 2 items on the consent agenda. Item number 1 is authorizing the execution of a Memorandum of Understanding, an MOU, between the City and the Minneapolis Park and Recreational Board to transfer grant funds to private property tree removal. Item number 2 is authorizing the submittal of a grant application to the U.S. Department of Housing and Urban Development to correct lead-based paint hazards and other housing-based health hazards in Minneapolis residential units. Additionally, due to the length of the agenda today and the limited time we have, I suggest we preemptively continue item number 4, a report on MPD off-duty fees, to our next meeting on August 7th. Are there any discussions on these items? Great. Seeing no discussion, I will move to approve the consent agenda as well as continue item number 4 to the August 7th meeting. All those in favor say aye. Aye. Those opposed say nay. Those items carry. The consent agenda is approved, and we will receive and file the report of MPD off-duty fees on August 7th. With that, we'll move on to the 3 remaining discussion items. Our next item is receiving and filing a report in response to a legislative directive related to the Minneapolis Police Department staffing and problem nature codes, also known as PNCs. I'll invite Commissioner Barnett to start us off, or someone from the Office of Community Safety or the Minneapolis Police Department. And as a reminder to the public, we continue this item on to this cycle as well. We got a presentation at the last cycle. We're just going to take a few minutes for members of this body that have questions to ask the chief, 911, questions that folks might have. So I'll start off by calling on Vice Chair Wansley.
Thank you, Chair Chavez. Thank you, staff, for being here to respond to questions that we have from your presentation. So I have a number of them. Actually, the first one continues or builds off of the question that I raised on I believe it was Monday at AO, where we talked about HR and specifically their recruitment and retention campaign that we allocated about $7 million of opera funding to, and it was supposed to go to hard to fill positions. The staffing study actually correlated that piece too and highlights the need for more staffing in investigations. So I just wanted to get a sense of if you all knew if any of those dollars went to hard to fill positions around investigations and also arson specifically. I believe that had sat vacant for quite some time around the period we did that appropriation.
So, thank you, Chair. Thank you, Vice Chair. No, I don't have any specific information regarding funding source.
Okay, so I'll just record that as another staff memo. You should have received that question anyways from AO in terms of, they mentioned that was an MPD matter and that HR likely wouldn't have had the response to that particular question.
Okay.
Yeah.
Chair, Vice Chair, to the best of my recollection, the civilian investigators we have are coming out of our budget. Mm-hmm. But I'll have to follow up. I don't think that's true. I'm just not certain.
Okay.
Yep.
Well, could you speak to, at least also with that $7 million outside of increasing the cadet classes, what, was used of that funding between 2022 and 2023 to support some of those hard-to-fill positions?
Chair, Vice Chair, I don't have information related to that.
Okay.
Yeah.
I will.
I think
Yeah.
the mayor's office, the $1 million campaign for recruiting, I think that came from this. I'm not sure. And it wasn't directed from the police department.
Okay.
Yeah.
And if Vice Chair wants, if you can communicate to the clerks the exact question you're looking for, just so we can, they can get that.
Yep. So outside of, and this is in reference to the ARPA allocation of $7 million that we council appropriated to recruit hard-to-fill positions in public safety, I wanted to know, in addition to cadet classes, what were the funds used for, and if they were used to help fill any arson investigators. You mentioned the civilian came out of the police budget directly,
Yes.
but I just know there was the $7 million to go towards hard to fill positions within public safety. So just getting clarity on that. Great. So next question, especially in light of BCR being here. So the expansion of BCR took place after the study was completed, which the study did emphasize, in addition to civilianization, the city should continue investing in services like that would take up other, or troublesome problem nature codes that MPD was having issues with responding to. Can you share a bit of the impacts that BCR has had to MPD response times, or just in general in responding to designated calls around disturbed persons?
Sure. Chair, Vice Chair, I can start it off and then I can pass it to Director Joni. It's the BCR program here is fantastic. It's very much needed. It's very helpful. But I do know there's still times when there is not a BCR unit available and police do to answer calls because they're busy with other calls and that type of thing. And I think the director may have some more information. There's times that also the police have to respond along with BCR because it's just not safe for them to be there. Director.
Thank you, Chair and Vice Chair. I really would give you the same information that the chief did. However, if you need more specific information on why there aren't times that they're available to respond, I can probably get deeper into that.
Yes.
But I will say that we need more. It's been a great program. I hear wonderful things from the police department about it. And it is, they're spread thin with the number of people that they have to respond to calls.
Yeah.
And you say you could share a little bit more about the piece of that Chief just referenced of why there might be some challenges there.
Sure, absolutely. So there's certain calls that we need to have the safety of a police officer there instead of just a BCR unit. There may be someone with a weapon. There may be someone who is physically aggressive. Now, that doesn't mean, and we do have calls, that the police will go out there, they'll get the safety situation under control, and then they can call on BCR to come in and handle any type of a behavioral crisis that anybody is having on scene. And that does happen frequently. They do work together. And there's other times that there's just not enough BCR vans to be out there and respond. If we get two priority people in crisis in the same area and the BCR van is on one, we have to send MPD to the other so that the situation doesn't escalate.
And just clarification, it was my understanding it's always been first responder policy where MPD goes out to secure a scene, so not just BCR, but for fire, that they will go first to clear, and then once it's deemed safe, then the other responder can come forward. Is there data that shows how frequent both are needing to respond?
I can get that data for you. I do not have that data in front of me.
Okay. Another question around, data of how frequent are both MPD and BCR needing to respond jointly? And then also, Claire, I want to make sure my understanding of like our first response policy, is that typically the protocol of law enforcement goes secure the scene, then once there is a clearance,
So-
everyone typically, yeah.
If there's a safety situation, that's correct. That is the policy. However, there's many calls that BCR can go on without having a police response going with them, and they do go on many calls by themselves, as long as it's a safe scene situation.
Okay. And it sounds like you might not have data. I think that's the piece too, of just seeing how often is that happening too. Yeah.
Sure.
Awesome. I don't know if you all have the slides in front of you, but my next question was actually related to page 10, actually, the report. So in that, or on that particular page, it stated that nearly 20% of all calls of service between 2016 and 2020 that involved MPD officers being dispatched could have been potentially handled through a non-police response. Does staff have a percentage of calls that could fall into that category as of now?
So, Chair, Vice Chair, talking about the CNA report itself, so through the public safety partnership with the DOJ, we were able to engage CNA again, because I think, as we mentioned during the presentation, all of the data that they had to do this analysis was prior to 2020. So they have come back. They are updating the report. And that will enable us to kind of have a better understanding of where we are today. So we will have that in the future. We don't have that now.
Okay. And I do know the report does, I believe on the first page, acknowledge the 2020 abnormalities when it came to staffing, but also said there were some pretty standard trends around staffing dynamics between that 2016 and 2020 data set. So was sure based off of that, just knowing the transition to moving some problem nature codes off, like if MPD had a better sense then of like what could be additional problem nature codes that could be transitioned over.
Chair, Vice Chair, I think we will have a better sense of that once we get this information back from CNA. They were here a month or two ago, I would say. So I'm hopeful to have some information from them with some guidance on what we can do. Did you want to add?
Yes.
Okay, I'm sorry.
Yep.
Chair and Vice Chair, as we did put into our PowerPoint presentation, even though the information was based on data prior to BCR starting and some of the other things we engaged, we have moved some things from the police department over to other departments and services. So most of this took place in late 2021, 22, where we moved parking response calls more to traffic control. Traffic control is on 24 hours a day now. We took theft reports, damage to property reports, things that officers used to go to, and moved those over to 311 or to the online reporting system, which has taken quite a bit off of the police department. I did try to get those statistical numbers together for you. However, 311 uses a different coding system than we do, and so all of their theft is under the same code, so I can't really give you a breakdown between what would have improved from ours.
Okay.
My experience tells me that it was pretty significant moving those.
Okay. Thank you. And then great to hear about CNA coming back. But one thing that I did appreciate about the report that was on page 20 is they also left MPD specifically with two different performance objective models that basically said you could use either one of those models to basically, respond to ongoing staffing challenges regardless of the data set. I believe the first one that they offered would have officers spending 50% of their time on service calls, and then the second would allocate 33% of their time. So could you share if there was any exploration of amongst leadership in choosing a performance model? Yeah.
Thank you, Chair. Thank you, Vice Chair. So yes, the trouble is that the officers' time demands continue to evolve, particularly as we're under the settlement agreement. I think 1/3 of an officer's time I think is the minimum of what should be available to engage in community engagement and non-law enforcement activities, whether that's walking the business corridor on Lake Street, or attending a community meeting or a safety meeting, and so on. The trouble that we have trying to implement that now is, one, the data and getting the data updated, but two, the increasing demands relative to training and implementing that related to the settlement agreement, and just figuring out as we get training approved and implementing that, how much time that in and of itself removes from patrol officers' duty day. So, for example, depending on what your position is in the department, it could be an additional 148 hours of training over the course of a year that an officer would need. And so that will also impact our staffing, and we're just trying to, as we plan that out, figure that in as well. But I do believe if we are going to say, I don't think it's, 50% time on calls. I think we need to be oriented towards at least 1/3 of all of the officers' time around non-enforcement community engagement activities. So that means everything else, their lunch, breaks, report writing, all of that has to be factored in, training, in-house roll call training, all of that has to be figured out so that we have 1/3 of the time left over to do community engagement related activities. So that's the direction that we're going in.
And I'm assuming with CNN coming back, is that also being reported out, I'm assuming, to them as they're updating the report too?
Chair, Vice Chair, this is the conversation that we had. And so my concern is not just, again, what time is dedicated for calls, but truly figuring out the time and the things that officers are doing on the shift, just driving in between locations. Like, I just don't want our goal to be, time not spent on calls. I want the goal to be specifically, in addition to training, everything else we're doing, we are requiring people to do community engagement as part of their regular duties.
Mm-hmm.
Yep.
No, thank you for that. And then another tool that they provided to MPD, at least as referenced on page 23, is an assessment tool to help predict future staffing needs. So that was something too, in light of not knowing what was going to happen after 2020. Here's something you all can use as you're, dealing with those changes. Can you speak, Chief, to how that tool has been utilized and if there's been any outcomes that you can share from the result of its use?
Chair, Vice Chair, I'm not familiar with this having been used since I've been here, at least. Yeah.
Okay.
I don't know if you. No? Okay.
Okay. Going to recommendation number 4, which is on page 25, going back to non-police responses. The recommendation was to have the city examine feasibility of implementing non-police response options for some of the PNC subgroups. The study had identified that this could free up between 73 to 106 patrol positions. And I know we're talking a lot about staffing shortages and staffing flexibility. So I'm just wanting to know, the director of 911 mentioned some of those problem nature codes that has been transitioned already out from traffic control. Just with those, can you share between BCR, traffic control, and I believe there was a third one you reported in the slide?
311.
Yes, 311. Is there a sense of how many positions have been relieved since from moving those 3 subgroups out of MPD?
Do you know how many positions we have in patrol? Chair, Vice Chair, we can get you how many actual fewer positions there are in patrol today versus 2 years ago, 3 years ago. We have that.
Okay.
So 177 fewer officers assigned to patrol.
Okay.
Today. Yep.
And we're not sure if that's tied to specifically that used to do traffic or some of the 311 or mental health response. We don't know if it was tied to those specific problem nature codes, though, right?
Chair, Vice Chair, we do know the calls that are being diverted that were not diverted in the past. And then the remainder of that are still being handled by police.
Gotcha. Okay.
And we also know it's just a fact that those are the fewer positions that we have today.
Okay.
Yep.
And then next question, recommendation 23, which is page 56. It asks MPD to review its response process for domestic PNC calls, identify the underlying cause for the lengthy response for these calls, and have them addressed so that they are responded to officially. And I know there was a slide that addressed this a bit, but just wanted to get a sense if staff could speak to what they've learned thus far as like the underlying cause, and if you've seen any changes as it pertains to domestics.
Chair, Vice Chair, thank you. As far as that recommendation, it's just important to remember that the CNA data showed all of the domestic calls, priority 1s, 2s, and 3s, and aggregated that data to come up with that response time, and that's why it was so extreme. When you pull out just the priority 1 domestics, it's down to 11 minutes. So as far as then looking deeper into that, no, we haven't, but we do know that that priority 1 response with the 11-minute time is within the realm of what we expected.
Great. Okay. Thank you for that update. And then going to the later part of the presentation, now I'm going at slide 17, where there were some, recommendations and considerations of like challenges. So I will name, I was surprised to see budget cuts as a reason for a lack of implementation. And I do recall in many budget conversations, we're often talking about MPD having a surplus, at least in recent years, or at least since the staffing study came out. So I just wanted to get a better sense of what specific budget cuts was this particular, provision referencing.
John, do you remember what that's referencing?
Yeah, Chair, Vice Chair, when we talked about that budget barrier to implementation and things being cut, it was really referring to a lot of positions being moved out from under MPD, like the crime prevention specialists, navigation, things like that took those civilian employees away from the MPD that we used for those non-police type responses, and that really helped support us. Ultimately, yes, they did continue to support us, but not in the same way when they were under the police department. Now, recently, we have moved the crime prevention specialists back under the police department, but that's what that was referring to. As far as specific numbers, I don't have those for you.
Okay, but not overall like budget cuts. I just wasn't, that part wasn't clear. It was related to those particular staff positions. Okay. And then another initiative that I've heard really good feedback on in my ward, but wanted to hear more from MPD on, is speaking to any outcomes of the embedded social worker and how it's impacted response times since its implementation.
Chair, Vice Chair, I don't know if having the social workers would impact response times. I do know. Well, I guess in a maybe not in an indirect way they would. So we have 4 social workers assigned. One has to cover 2 precincts. They've been extremely helpful, especially in areas around kind of repeat calls, repeat victims, and problems that are just honestly outside the scope of what police deal with. And that's very time consuming. And I do know there are times, I think we recently, didn't we give them radios recently?
Yes.
We recently gave them radios because they do go out at times to do follow-up. So I'm sure there, in the long run, there must be an impact on response time, especially if they're correcting the reasons why the calls are happening in the first place. But I don't know if we have like a direct mechanism to show that. Someone would probably have to look at kind of like the work that they're doing, the repetitive nature of some of these calls, and I'm sure that as they correct underlying problems, there's going to be an effect.
Yeah. Do you know if you all are going to ask for that to be incorporated in the updated analysis done by CNA?
Chair, Vice Chair, I know they're aware of the changes that have happened. I don't know how in-depth they're going to get. Because this isn't being paid for by us. It is being done through the PSP. And I know they've made clear that they can't be as in-depth as they were the first time. So what exactly we're getting, I'm not sure.
Okay. Because as you already shared, I will also name in my ward, we had a community safety meeting not too long ago. And Inspector Gomez actually shared about, just some of the outcomes from having the embedded social worker, where you mentioned the repeat calls. And I saw that as a correlation to response times. As Inspector Gomez mentioned, there was that repeat person that they were taking time to respond to, and the issue or underlying issue got corrected. So was then removed out of their rotation for responding. So it would be great to have that incorporated, knowing like that's been a crucial support to you all.
Yeah. Chair, Vice Chair, so I guess I'm thinking of this in terms of the volume of thousands upon thousands of calls and how it can be easy to miss something like that when you're dealing with data like that, and just thinking like, how would we come up with this? I in no way meant to devalue the work that they're doing. It's incredibly helpful. It's amazing. We absolutely need it. But I was just thinking in terms of data, how do we show that? There's no question that there's an impact because they're eliminating the reason why the call happens in the first place. I just know it's difficult to prove something that doesn't happen, right? So,
is there a way to track referrals, at least, like data of how often officers are being able to utilize them through referrals of bringing on the social worker?
I would have to, Chair, Vice Chair, I would have to follow up. I don't know how they're tracking their information. I'm sure that they are. And I don't know how well that would correlate with our work. I mean, I know there's even at times where officers are informally, not because of a call, because of something they're aware of, bringing an issue to a social worker, and the social worker is fixing the problem. I don't know if you have, Director.
Chair, Vice Chair, I think the only thing I would add to that is I think it would actually take us a long time period of gathering this information in order to see the positive impacts from that. I can use the example of BCR, which we've had for a couple of years now. Have they helped to take the load off of some of our repeat callers? Absolutely. But as the chief stated, it's difficult to prove what might not have happened. I can just tell you I've had repeat callers for 4, 5, 6 years, and now they're having face-to-face interaction with BCR, and it may be slowing those down, but I do think that that's the statistical number, both on the police side and on the 911 side, that would take a couple of years of data to accumulate and really see the impact.
Yeah. And I just want to flag for our body, I think those are the type of trends or data that we would like to see, especially, I mean, taxpayers are paying for BCR services. I'm trying to remember if we are, if the county is providing the embedded social worker, and if we're covering a portion of that.
Chair, Vice Chair, I do know they are county employees.
Right.
I don't know about the funding behind it, though.
So just knowing, we want to make sure we can speak to, like, anecdotally, we're hearing these positive effects, but to be able to say, especially as we're embarking on some fiscally challenging years ahead, that we can say, oh, here, it's absolutely supporting you all. It's great to have you all come up and say that, but also to be like, and this nice little pie chart says, or whatever. Yeah. Last question. Just wanted to also hear, when it comes to some of our other non-armed partners, just also your relationship with some of our GVI or violence prevention groups, and how that's also supporting some of the staffing challenges.
Chair, Vice Chair, I have relationships with a number of community-based violence prevention groups in town. They're incredibly valuable, particularly those that are out. There's a number that do different types of programs and things, but particularly those that are out on the street and really helping to resolve conflict, because so much of the violence that happens in the city is just is a result of poor conflict resolution skills. I mean, I don't know how else to describe it. It's beefs, it's otherwise stuff that's happening, and it's incredibly valuable. And a lot of these groups, they have their contracts and they have their places that they go to between the hours that they're supposed to go to. But a lot of these groups will come if one of the inspector calls and says, we're having, we realize historically we had a problem over here, but this week we're having a problem on this block, and they're responsive to that. Some of the culturally based groups have been helpful dealing with some of the issues that we have. So yes, it's extremely valuable, and they do work with us. But again, I don't have data to show that. And to some degree, I don't know if they ever could prove that there's a problem, between this person and that one, and they resolved the conflict and followed up with those people, it's violence that didn't happen. And I don't know if there's a way that would ever be proven. I just know innately from being on the street that works, in a way that police can't deal with stuff like that,
I will say, I will flag that as a staff memo and likely to NSD. We actually have a former, before it was NSD and OVP staff member here who did that data tracking. And I know last term did a presentation of how many conflicts were deferred or avoided, and we're able to quantify it. And I think that's been part of why we've advocated for an analyst position in NSD, so that tracking can happen to supplement the work that you all are doing and data that you're collecting too. So I would like to flag that. That sounds like that might be an NSD question, because I know they've tracked that before amongst their partners.
Yeah.
But
Thank you.
that's all the questions that I have. I'm giving clerks the follow-up questions. Thank you so much. And just quick, do you have a sense of when that update from the CNA would likely be done?
Chair, Vice Chair, I don't, but we meet with PSP, who is the convener for that, every week, and I'll follow up and ask for an update. Yep.
Okay, thank you.
Next up, we have President Payne and then Councilmember Rainville.
Thank you, Chair Chavez, and actually thank you, Vice Chair Wansley. You touched on a lot of my questions. Most of my questions were around that refreshed CNA analysis. So I'll maybe ask, I think you may have spoken to some of the answers of my questions, but I'll just kind of try to focus it. What do you think the scope of that will be in terms of, because to me there's a few variables here. One variable is just what are the calls for service. Obviously from 2016 to 2020 we captured some of the giant fluctuations in trends, but I mean that was probably a very noisy data in 2020. I would even argue this year's data is probably still pretty noisy. We haven't reverted to the mean, so to speak. But would you envision the scope of their analysis being limited to just taking 2021 through 2023 data and then putting it through the same framework that they did for the previous data set, or do you envision them actually making changes to the framework, whether it's that performance goal of what percentage of time is patrolling versus administrative, or we do have a lot more knowledge about what BCR could take on, let alone other ideas around calls for service that could be responded to, non-police responses. Do you see any changes to the framework, or do you see it as being much more limited towards just taking fresh new data, putting it through the same model?
Yep. Chair, Council President, PSP has made clear to me, because I've asked for everything, that I'm not going to get everything. But other than just coming and taking data, they have been here. They have done interviews. I don't know if either you want to speak to any of the specifics with any of the interviews that they've done. And they do recognize that kind of the environment and the situation is different. So I do think we'll be getting something different back. I just don't know how in-depth it will be. If you wanted to add anything, I don't know.
Yeah, Chair, Council President, the data in the report that we're getting back definitely will not be as long as detailed as the report we're discussing today. It's going to be focused strictly on patrol staffing itself, and then the call volume and what we can do and how we can allocate our numbers and shifts and things like that. When their subject matter expert was here, he did meet with shift lieutenants, shift sergeants, officers, did ride-alongs in every precinct, talked to everybody, got a lot of that information. But again, it's going to be at a much higher level. And then if we see we have some questions coming out of that report, we can go back and start to narrow the focus of what we want to see.
And Chair, Vice Chair, Councilmember Payne, I think from the 911 perspective on this, you'll see some similar data, or some similar information in there, but now we have some data to support some of the recommendations they did make that we were already in the process of doing, moving some of those reports. The other thing that we learned through that report, through the CNA report, was we share a CAD system with the University of Minnesota and with Hennepin County EMS. And so when they first compiled all of those numbers and those problem nature codes, they included those in there in that report. And so that some of that information will be pulled out in the next report because we don't, even though we share the computer system, we don't respond to those.
And then one question on the embedded social worker, and the context here is I've worked with Chair Chavez to convene some cross-jurisdictional stakeholders around juvenile diversion programs and, what are the gaps in that process. And one of the topics that emerged in our last meeting was, diversion is actually an alternative to charges. And so you still have to have that probable cause for charges. And now as I think about this embedded social worker, I have to assume a lot of their caseload is not going to be around issues where you have probable cause, that diversion would be the kind of alternative path to charges. It seems like this is before that probable cause scenario. And I'm just trying to think through, we were trying to, first of all, just come up with a name of what are the interventions that we want to call this pre-probable cause intervention, so that we don't need to do brainstorming right now. But I'm just trying to think, when we're talking about data and tracking and specifically intentionality around those interventions, do you have any thoughts around how we should be thinking about, particularly from a resource perspective, the opportunities for that before we even have probable cause? We might know somebody, whether has, a young person with some developmental challenges that are leading to behavior risks, or an adult. I just met actually with a resident of mine who actually just purchased a recent home that used to have an adult that had, I think, some real challenges and was like living in an RV outside of the house, and it was like a real big problem. That person is now moved on, but it was like a real big livability challenge. It wasn't a policing issue though, as such. And I see the embedded social worker as one of potentially many interventions that are not about crime and probable cause, but about intervention and getting ahead of things. And I don't know if you have any insights on ways we should be thinking about that in this context.
Chair, Council President, I think that's exactly it, what you just said. If we step back and think, why do we have concentrations of crime in certain places? And it's obvious, because we have all of these challenges that exist in society in the first place, and then the police are showing up after the fact. And yes, I think there's definitely examples I can think of that happen here, where we have dealt with a youth that had special needs, that was a repeat call situation, but that's not the only problem. Like, mom's a victim of domestic violence, and, there's all sorts of other problems as well. And instead of just sending the police and then having all of these issues be siloed with all of these different government agencies that don't talk to each other, the social worker has been kind of the linchpin to try and pull stuff together. And that is not easy, especially when, frankly, the laws are set up in ways that agencies are not allowed to share some of this information, even if we wanted to. The schools can't, Child Protective Services can't, and so on. And we all know parts of the problem, but there's no one entity that's responsible for fixing it. And the social workers that are here through the county have been doing that. And that's just, I believe that's just a point that hasn't existed here before. Yeah.
Thank you.
And then I'll pass it on to Councilmember Rainville.
Thank you, Chair. So I have comments. I don't have questions.
Yes, sir.
And I just want to, Director Hodnett, I had occasion to call 911 on Saturday evening. There was a woman who came into our church and was having a mental health crisis, and my wife took her downstairs to clean her up a little bit, give her a sandwich, and the 911 operator was incredible and very efficient. And within probably 15 minutes, there was a canopy worker. So I don't know if I'll be able to stick around for the canopy presentation. This seems to be going along, but I really believe in that canopy program, and it proved itself. And they calmed her down. It took maybe 20 minutes, and eventually she agreed to some help, and they took her away for shelter. So the system really worked well there. So thank you for that. DC Kingsbury, I haven't seen you since the 4th of July. Your team did a great job on public safety. There's a little snafu in that Dinkytown area, but I think the arrests prove that these kids cannot come into our city and do their violence without being held accountable for it. So thank you for the great work on the 4th of July for all your precinct teams. And Chief, I just want you to walk away from here knowing that as I'm out in the community, you have changed the perspective of all the citizens since you were hired. And we are no longer in 2020. We are no longer in this crisis and chaos where people were very, very fearful. Through your leadership, you have shown that we are improving, that things are getting better. We've learned our lesson from 2020, and you're creating that hope, which only a true leader has that ability to do. So thank you very much for all the hard work you're putting in.
Thank you, Councilmember.
Thank you. And just for my colleagues, since we talked about the social work program, that was approved in the fall of 2022, and I believe it was from MPD's budget based on the RCA I am looking at, that is set to expire at the end or at some time this year. So I think what would be helpful to know for MPD, and you don't have to answer right now, but what are the next steps for that? Is MPD planning to continue that program with the Hennepin County since it's a 2-year program? And then that would be helpful. Since we're talking about it, I figured I'd ask if you have the answer to that.
Chair, thank you.
Yeah.
Absolutely, we need it. We need at least one in all 5 precincts. And just for context, I know, so September 22 is before I started. I became the chief November 7th, 22. I know we didn't have the social workers then, so it was a time to get people in place. And obviously now we have 4 out of 5, but the social workers are absolutely necessary, so we'll be doing what we can to renew that.
Perfect, thank you. And then the other part, I was also going to ask questions about what you all meant about the budget cuts to MPD, something that I think would be helpful given the response we got, that it was mostly positions moving out of MPD into neighborhood community relations. It might be good to just be able to clarify the presentation, so when the public reads this, they know that it wasn't necessarily budget cuts to MPD, but positions from MPD moving to NCR. And if we can work with the clerks to just clarify that presentation, I would appreciate it.
Thank you, Chair. I agree. That's not clear. We will clarify that. Yep.
Okay. I'll pass it on to the city attorneys, but I also want to welcome Councilmember Chowdhury. I didn't realize you were here.
Thank you, Mr. Chair. On the embedded social workers, I've been working with MPD staff. The chief's obviously got bigger fish to fry, and I think that is now going to the end of 2025 with an option for another year or 2, and then that lines up with the 2 embedded social workers that the city attorney's office is contracted for with Hennepin County. So I think we're covered till at least the end of 2025. Thank you, Mr. Chair.
Perfect. Thank you. If you can email me that update, or basically this, just so we can send it to the rest of council members, knowing that that's happening. That way we can, if you would actually mind emailing that update to city council, that would be helpful. Perfect. Thank you. And you answered my question basically about making sure we just update the presentation just so the public knows what we meant by that. Perfect. That's all the questions I have, but I think Councilmember Palmisano, were you trying to pass it to our city attorneys or? Okay, perfect. Thank you. All right. There's no more questions. Thank you so much for being here. We really appreciate you all coming back today. Thank you. So seeing no further questions, I would direct the clerk to receive and file that report. Since we continued item number 4 to our next meeting, we will now move on to item number 5, the Minneapolis Public Safety Beyond Policing item. I'll call on Vice Chair Wansley to introduce that item and walk us through the next steps.
Thank you, Chair Chavez. I'm going to wait until my awesome staff member Celeste pulls up the presentation. But essentially, many folks are aware that we included in our work plan this past spring a shared goal to support the implementation of the Safe and Thriving Communities Reporting Plan. So this is basically outlining the ways in which this body is going to deliver on that particular commitment in our work plan. And then we will also receive a presentation giving us an update on that plan from the administration. Director Harrington is here, as well as Commissioner Barnett from OCS. But I at least wanted to start off with a presentation outlining the ways in which the committee will be approaching this component of our work plan. Isn't that having some technical challenges? While we're doing that, anyone knows any dad jokes? My grandpa jokes? Councilmember Rainville? No? Oh, Councilmember Arring, okay, another time. Okay, so let's go to the second slide. So basically, since the murder of George Floyd in 2020, we know that the city of Minneapolis, especially us as city leaders and the mayor, have pledged to do better and to provide all of our residents with a public safety ecosystem that includes a wide range of diverse services and programs that ultimately keeps everyone safe. In 2021, the city council authorized a contract with Leadership for a Networked World at Harvard University to create a Minneapolis-specific report and plan for building out our unarmed public safety service infrastructure. The result was the Safe and Thriving Communities Report and Plan, which I believe many of you have read through all 200 plus pages. And it was presented to the Minneapolis City Council as well as the public in July of 2023, so last year. The report included a vision for a comprehensive public safety system and included detailed recommendations on the systems, infrastructure, human capital, leadership, governance, and policy changes required to implement the vision that was outlined in that extensive report. There was also inclusion of a comprehensive 10-year action plan that was provided at the end of the report, and it's broken into 3 separate phases. At the time of last year, where council and the public received introduction to this report and plan, the mayor's administration basically shared or stated that this was going to be their guiding plan for building out our full ecosystem of preventative, responsive, and restorative services that, when it comes to infrastructure, we've demonstrated through the creation of the Office of Community Safety and the many positions that we've allocated to implement the work that's outlined in this blueprint. This spring, the Public Health and Safety Committee, as I mentioned, we voted to adopt a work plan that included supporting the implementation of the Safe and Thriving Communities Report and Plan. And I know many of us championed the inclusion of that particular provision because we also have lived through the 2020 election series, and we knew from our residents that having a clear plan for our non-MPD public safety efforts will ultimately help improve alignment and transparency between the administration, the council, and the public on how we're moving beyond centering armed law enforcement responses within our public safety system. And essentially our goal, which I'll talk about in the next couple of slides, but the council-led process that we're initiating around this essentially gives the mayor the opportunity to have council formally adopt this plan that his administration has said is the blueprint for change. And I believe there's shared agreement amongst this body as we reference this plan and report a lot that there is agreement that this is the direction that we want to move towards. So next slide, please. So let's also start with what is an action plan, which many of us, either if you're newer or you're not, we have seen different and various action plans come before council, thinking of the climate equity plan, the transportation action plan, also the strategic race and equity action plan, number of plans that council have considered in the past. But I do want to reiterate that what we're considering today is not council attempting to create a new plan. That is not within our authority. What we are doing, however, is advancing our work plan that we adopted this spring, which highlighted that we as a body would support the implementation of the Safe and Thriving Communities Report and Plan, which included that 10-year action plan. And I think there's shared agreement that we know because our residents ask for plans continuously when we're talking about public safety. We do know the benefit of having comprehensive plans ultimately help ensure that our enterprise has basically shared alignment around what our long-term goals are. They help to prioritize, strategize, and make measurable progress towards the city's long-term goals. Timelines are clearly identified. There's leads in terms of department leads around strategies that's going to help us reach said goals. And then it also offers, areas of support for us to do transparency work, to make sure that there's accountability, and to make sure that there is clear, consistent frameworks for us to use our budget authority to make intentional investments. So that is the main reason why we do plans, and this is not atypical for how we approach other issues like climate equity, like housing, like transportation. What we have failed to do is actually fully adopt that when it comes to public safety. And by moving forward through our work plan process, this essentially allows council to use our oversight and budgetary authority in alignment with what the administration implementation goals are as it pertains to the Safe and Thriving Communities report and plan. So with that, legislative process, because I'm really excited about this, because essentially us embarking on this work is helping us create space for both the public to hold the council as well as the administration accountable to delivering on a robust, comprehensive public safety system that they have been asking for years. So essentially, with the legislative process that we are going to be embarking on, we want to make clear how we're going to do this. So starting today, we are going to be receiving council's first presentation on the specific 10-year action plan that's included in the Safe and Thriving Communities report. Then we will be taking action on the legislative directive that my office is bringing forward that will allow this committee to receive crucial updates from the administration on their progress in advancing the plan contained in the report. Then this committee will open up a 45-day public comment period on the report and plan that we receive, a presentation on today, and basically that public comment period includes written feedback. We are also going to be working with the administration and our partners at Harvard and the New York University Policing Project to hold engagement sessions. This committee will also be holding a public comment period in the fall on this. And essentially feedback generated through these venues will be brought back to PHS for further consideration. And then my office is going to be working with city staff and committee members to take appropriate legislative action to ensure that we are entering into our budget deliberations with clear guidelines and expectations of what is needed to advance our public safety beyond policing strategies and goals into 2025 and well beyond that. So I at least wanted to do some level setting before we get into the administration's presentation on the plan and share how we're really going to embark on one key component of our work plan that many of us was excited to create and really realize during our time on this body. So with that, I will pause and answer any questions before passing it over to Director Harrington.
No one's on cue, Vice Chair.
All right, then. So we can pass it. Oh, I see.
Actually,
Councilmember Palmisano.
Mr. Chair, Councilmember Wansley, I'm a little confused at what's going on right now. I'm a little confused maybe because we don't ordinarily present from the dais, but it sounds like you've just outlined a plan as to what's going to happen. Can you go to that last slide that kind of speaks to a timeline here?
Oh, the timeline for the legislative process?
I was of the understanding, yes. I was of the understanding as of yesterday that Dr. Oftelli wouldn't be able to make it here today because of basically Delta flight issues and cancellations. But so it sounds as though we are still going to have an update from either Director Harrington, well, sounds like Director Harrington, though I didn't realize that. But there's a legislative directive here in front of us that I have some questions on that we got an email from the city attorney about this morning. And so how are we saying we're doing a comment period? Like we get updates on this report and on its implementation regularly from Director Harrington and others. And so can you help me understand, are we adopting this again? Like, we did receive, file, adopt, I thought, the Safe and Thriving Communities report from Dr. Oftelli a long time ago. But what are we being asked to do with this slide? I guess, could you help explain to me this slide is there something different or new that you're adding in here other than your legislative directive?
My apologies. I would say your comments actually made me a bit confused, so I will try to answer them from the best of my understanding. So first, I led with saying we're not creating a plan. This has already been touted from the administration as their guiding principle and blueprint in terms of the Safe and Thriving Communities report and plan that we have paid a lot of money on. So what we're doing, and I think it's pretty clear here, is we're doing a receive and file, which actually I will correct you on that. While this body have received updates on the report part, we never received an update on the 10-year plan that's included at the end of it. So this will be the first time where this body will actually get a chance to touch base on that. Again, already created by Harvard University, we're not creating anything, receiving and filing that report. In terms of the legislative directive piece, I also sent an email out with an amended version, which is before you, before committee, which clearly stated that, we took consideration of the feedback provided by the city attorney as well as OCS leadership and incorporate that into the legislative directive to get updates on the actual plan that's included in the Safe and Thriving Communities report. One thing about that too, I'll provide clarification or correction on that. As of now, this committee has not received updates on the Safe and Thriving Communities report. What we've received updates on, because I've worked closely with Chair Chavez in curating our meetings, is updates on the South Minneapolis Community Safety Center. We've received updates on OCS and some of their various projects, but we have not dived deep into that 200-page report and plan specifically. So that's essentially what we're doing. And then again, I just want to remind folks, this is already built into our work plan that we approved this spring, where we said we would be taking action to support the implementation of that report and plan. And this is just saying, okay, that's what that process looks like. Because we also told people in the creation of that work plan, please feel free to step up and lead however you want to advance any of the components in this work plan and the strategies included. My office made it clear we wanted to lead on here, so this is what I'm proposing. That opportunity is available to any other, council member who has key components added to that work plan that they want to see move forward through the committee's process and ultimately our legislative process.
So if I understand correctly, we're taking this piece of the Safe and Thriving Communities report and adopting it formally and going to get regular updates on it? Is that essentially what, is that a summary of what you just said or no?
That is not nowhere near what I said. There's no adoption here. We're receiving and filing, and I believe you're aware of what a receiving and filing is. We're getting
we
updates.
don't need to.
We get updates on that. Adopting would mean a vote, and as you can see in the fall, what I am proposing is working with city staff and my colleagues on figuring out what are appropriate legislative actions that we can take to continue supporting this work. But there's nothing in here that says adoption.
Okay. I'm a little bit concerned about the idea that we're looking to project out 10 years of innovation work. That's not usually how innovation takes place in any organization, is to know 10 years ahead of time. We've all committed to and have a shared agreement and wanting to implement the Safe and Thriving Communities report. This just, I guess I'm a little bit concerned on the utility of this or what the 45-day comment period is going to seek information or feedback on. But I can take this offline with you for more. So thank you. I was just trying to get my bearings here. Up here. Was there a press conference on this that I perhaps
Is that
wasn't?
germane to the topic right now?
I think, well, I'm asking, was there a press conference on this topic that I perhaps wasn't engaged on, invited to, et cetera?
Councilmember Palmisano, I don't understand how that's related to what's in front of you.
Well, I don't-
We
I don't know
can
if
talk
it is.
offline about that, but what I will provide clarification on what you did say is, as I mentioned earlier, it is not uncommon for us to do 10-year plans. If anyone, and you were definitely here when this started in this beginning iteration, we did the 2040 comp plan that really gave us a 10-year blueprint on how we were going to approach transportation, housing, and public safety. We all have had extensive conversations about housing. There was a whole lawsuit that we had to settle through the legislative session just this past year around that, and that's our 10-year plan for how we're adding density to the city. We literally passed the climate equity plan. That's a 10-year plan for how we're going to become a more resilient city when it comes to climate change. So it's actually, I want to correct you there, it's very typical for us to have 10-year plans when it comes to critical priorities of the city, and public safety is no different. And that's exactly why I'm sure, the administration brought in Dr. Oftelli to help create this and commission this report and plan. So with that, I'll answer any other relevant questions to the presentation.
Do you still have questions, Councilmember Palmisano?
I do, but I'm not going to continue this conversation.
Sounds good. Thank you. Anybody else? Great. I believe next up we have Director Amanda Harrington that's going to proceed with the next part of the presentation. Welcome. Thank you for being here.
Thank you, Council Chair. Amanda Harrington, Director of Community Safety Design and Implementation with the Office of Community Safety. I feel like you know that since I'm here frequently. Councilmember Wansley's office did reach out to Dr. Oftelli to give this presentation today, and as noted, unfortunately, he was unable to be here due to flight issues. He does send his regrets. I was not consulted about the purpose of this presentation, but Dr. Oftelli did loop me in, and so we did create this presentation together. I hope I can do it justice, even though I meant to present this jointly. As noted, the Safe and Thriving Communities report was written by Dr. Oftelli and his team with Leadership for a Networked World. The report includes a plan to bring transformational change, improve community safety services, and increase transparency. It provided the city with a North Star and guidance to reach a new level of value, legitimacy, and trust in how Minneapolis creates and sustains safe and thriving communities. It changed the conversation from the focus on public safety to community safety, which, as I've noted in prior presentations, is a broader concept. It also promoted the idea of a safety ecosystem. This is the idea that the city doesn't have to go it alone, but should work with community partners, businesses, and other governmental organizations to address safety. And we can't just focus on crime and violence, but we have to provide services that address the root causes of safety issues. The council's heard me talk frequently about the 3 buckets of work: safety, services, including prevention, response, and restoration. These came directly from the Safe and Thriving Communities report. I'll skip a bit of this history because Councilmember Wansley's presentation included that. But the final.
No, please don't. Please go through it, though.
All right, the origins of this plan do go back to 2021. Dr. Oftelli, who's a native of Minneapolis, came to Minneapolis to provide advisory services related to community safety, health, and resilience. That led to discussions where the city asked for more details about how to weave together current efforts and strategies with national best practices. Dr. Oftelli and his team worked with the city and community during 2021 through 2023, and the final report was presented in July of 2023. Around that time, the Office of Community Safety had significant change in leadership and then started to build out the team that could actually do this work. As you know, I was hired in December of 2023 and started to build out my own team in 2024 so that we could provide the dedicated project management capacity to implement the plan that is suggested in the governance and leadership section of the report. While much of my work in the last few months has been focused on learning about the city and creating the Lake Street Safety Center and the South Minneapolis Community Safety Center, I have also worked on the larger ecosystem work and have included that information in my presentations to this body every month. Even though those presentations are called the Community Safety Center Update, they do include information about the activities toward this larger ecosystem. In addition to this update, I did provide a list of activities from the launch list in the Safe and Thriving Communities report, as well as some of the near-term activities. We would be here a very long time if I went through each individual activity, but that list, along with updates on progress for those, was provided to City Council members on Friday by email. Some examples of the work that has been done: we have formed and regularly convene interdepartmental committees starting in January 2024. The committees have been shared with this body previously, but the work that they're doing includes resources and services, community relationships and communication, infrastructure planning and design, and finance. The groups don't exactly match the recommendations in the Safe and Thriving Communities report, but they are what we need at this point in the process. And that is one of the key pieces of implementing the Safe and Thriving Communities report, is that we can't just take it as face value. We also have to live in the conditions of the current climate in the city. And so we will not always do every activity exactly as noted. We sometimes have to be flexible. Another milestone was finalizing the design and implementation mission, vision, and values, which have been shared with City Council members and on our public webpage. We are currently working on elements of the launch list and near-term activities, as I noted. And while we've had this plan for a year, work began in earnest when I was hired to oversee implementation. Thus, we're still within the first year of implementing this Safe and Thriving Communities report. I just talked about near-term, short-term, kind of phase one activities. The Safe and Thriving Communities report defines phase one or near-term work as the work establishing the necessary foundation for deeper, long-term transformation. This is the most important, but probably the least publicly exciting part of the work. While we can implement pilots, and that will be much more attractive, much of our work is actually about creating agreements between city departments, analyzing policy, procedure, and systems, and creating opportunities for collaboration and coordination, both within the city and community and with other governmental partners. I did think it was interesting, however, that the report called out that the city may have all the tools we need to succeed, that it's not necessarily about creating new services, but that we need to focus on how we get the systems to work better together and use data to monitor and improve the services that we offer. Now, sometimes when I'm reading reports and listening to presentations, I think, that's a lot of nice words. So what? What's actually happening? So here's the so what. We have done quite a bit of work. As I've mentioned, we've added dedicated project management capacity with my hiring and that of my team, which includes a senior project manager and business process data analyst. We also talked about the interdepartmental committees that were formed to assist in this work. We executed the contract with NYU's policing project to assist with early stage implementation, which includes the asset and gaps analysis and subsequent recommendations, as well as dashboards for non-police safety services. We completed an intense round of initial community engagement around safety centers, but we also used that as an opportunity to introduce concepts from the Safe and Thriving Communities report to our community, including the definition of community safety, what a community safety ecosystem is, and those 3 buckets of services. In addition, Outcomes Minneapolis was also introduced by Performance Management and Innovation, which will assist in many of the recommendations regarding measuring services and increased transparency. 4 action plans or action items from the launch list have been completed, and all others are currently in progress. Many other near-term activities are also in progress, including creating a community advisory board, working with the policing project on dashboards. Performance Management and Innovation is currently researching performance-based contracting, which is called out in the Safe and Thriving Communities report, in the hopes that we can pilot that and use it with some upcoming contracts. And the policing project is also working on the analysis of the asset and gaps analysis. More about that on the next slide. We've also been working on community engagement and communication to bring everyone along in this journey. So I currently provide monthly updates to this committee, as noted, and those do include my work on the larger ecosystem. I provide weekly email updates to city council members, and it's my hope and experience that people reach out to me directly from those emails if they have questions or need additional information. Internally, we also have a Teams channel and a SharePoint site for city staff who are working on these committees, and we also continue to develop and build out our public webpage. The policing project was brought in to build off of the Safe and Thriving Communities report, but also to help us make progress on the near-term implementation, like building out dashboards, for example. The asset and gaps analysis is ongoing. We started surveying service providers in early 2024, and the policing project has been having follow-up conversations with some vendors and city staff. The initial draft of the analysis is actually due this month, with the final report, which would include recommendations, expected this fall. Those recommendations should include things like programming, resources, or process improvements. We continue to meet with the policing project weekly as this project commences, and they give us recommendations along the way. And Dr. Oftley is not completely off of this project. He is a consultant and will be integral to making the recommendations that come out in the final action report. The Safe and Thriving Communities report was very broad and far-reaching. It's one of the reasons that we asked for the policing project's asset and gaps analysis to look more closely at certain services. That will not only help us determine what services should be scaled up, but also how to do it. The dashboards they're working on currently include responsive services that are dispatched, such as BCR, animal control, traffic control, and police reports taken by 311. We know we need to develop budget projections for current and new services, and as I've said since I started, this work does not necessarily align with the city budget timelines, so we provide that as we are able. Next year should be much better because I will have been here a full year to match up with that process. The asset and gaps analysis will provide us information to help in these areas, such as understanding if we have contracted services in the right geographic areas of the city based on crime data, just as an example. We're working to develop systems and processes to increase collaboration. One example of this is a convening that we're holding on August 6th for safety service providers to help them build relationships and understand who is part of the current ecosystem. This also means establishing meetings or processes so that information can be shared between police and community partners, or between the city and county, who both may make referrals to community vendors for similar services. Another great example of this is a meeting that I attended yesterday that was hosted by Council President Payne. He mentioned this already, bringing together city and Hennepin County. I hope to do more of that as this work progresses. We also need to track the efficacy of the city services and those that we contract for. There's a lack of consistency in the data that we collect from vendors, and we're working to create a platform that every vendor could use to report their data, which would also make it easier to analyze and then share back to community. That doesn't mean collecting confidential information necessarily on a specific person who received services, but we need to know more than just the number of people who were served by an agency. We need to know if the service resulted in a positive outcome. And I feel like this is related to the conversation that you were just having with the Chief of Police and Director Hodney. Related to that is a platform to share information and dispatch services beyond city staff. We do this already with BCR, and we need to explore how else this can be done. I'm hoping to have ambassadors, for example, operating on this type of system in some parts of the city next year. All of this work requires staff capacity, as noted in the Safe and Thriving Communities report. And so neighborhood safety, the Office of Community Safety, Performance Management, and Innovation, just to name a few, have been hiring and onboarding their staff. In addition, 911 is hiring and training up quite a few staff. All of this should help with capacity toward working toward the action items in the Safe and Thriving Communities report. There's a lot of work currently being done. This month, we're starting to evaluate the efficacy of current services. This will not be a fast process because there are a lot of contracts that we hold throughout the city, and they don't just live in Office of Community Safety departments. One of the contracts that we're looking into is violence interrupters, again, looping it back to the conversation that you were just having. we should be able to help provide some of the information that I think you're looking for that you've said you've had in the past. We're also facilitating increased collaboration with safety-related projects on community engagement. For example, when I was out doing engagement around the South Minneapolis Community Safety Center, community members had questions about 3000 Minnehaha. Working together, having us both there at the same time, would actually be more respectful for community and actually less burdensome. We will have a better understanding of the current state of the ecosystem with the policing project's asset and gaps analysis. And once we are fully informed, then we can make more changes to those services. We also have to help everyone, community members, city staff, businesses, understand what the safety ecosystem is. This is a new concept for folks, and they don't necessarily understand the shift from public safety to community safety. This will be more likely include community conversations, but also print materials, updates on the website, maybe videos. We're currently working with NCR and communications staff to create a 2-year communications plan around this. This fall, we should have some of the dashboards already up to help people increase their understanding about the impact of services in the safety ecosystem. The full policing project action plan will be this fall, I mentioned that, but we aren't waiting for those reports or recommendations to move along with work. We have pilot projects that we're already in the planning stages of, including the work, expanding the work of traffic control staff by having them respond to non-injury vehicle accidents, embedding a social worker in 911, which was a recommendation from prior work group work, and having safety ambassadors on the street in some cultural districts. Those should start later this year and into next year. Looking forward to 2025, we're creating the structure to require enterprise-wide collaboration on safety systems. This means we look at RFPs or contracts for professional services, and we would have a committee, including a community advisory group, review those proposals to ensure collaboration with other services are built in, as well as metrics for success. Next year, we will also work more on the phased implementation of recommendations from the Policing Projects Action Plan. And we'll increase the dashboards that we have available on our public-facing website so that community can better understand the work of even more safety services. Longer term, looking further out, I've mentioned this before, but we want the design and implementation committees to act as a think tank so that they can forecast needs of the ecosystem instead of just being responsive or reactive. There are many, many other steps that we need to take to reach the North Star described in the Safe and Thriving Communities report. And we know that the ecosystem will need constant refinement and adjustment to keep it responsive to community needs over time. I will continue to update the City Council and the community on all of the steps it takes to get there. I'm available for any questions.
Thank you, Director. I'll see if any of my colleagues have any questions. I'll pass it on to Vice Chair Wansley.
Thank you, Chair Chavez. Director Harrington, I saw the reference a couple times to the Policing Project Action Report. Can you speak a little bit more of how that's going to relate to the 10-year action plan that's included in the Safe and Thriving Communities report?
Thank you, Chair Chavez. Councilmember Wansley. As I mentioned, the Policing Project's work should build off of the Safe and Thriving Communities report, so it very likely is that there is an action item on the Safe and Thriving Communities report that takes many, many steps to get there. The Policing Project's action plan would delineate some of those steps that would get to one of the larger activities.
Thank you for that clarification. Only question I had. Thank you for the presentation.
President Payne.
Thank you, Chair Chavez. Thank you, Director Harrington. This was if nobody told me that somebody's flight was canceled, I would have assumed that you just spent all, your time preparing this because this was such a really good presentation. So I thought you did a really good job filling in. And I just wanted to speak to the value of this type of transparency so that not just us here on the dais understand what is the progress that's happening, but so that the public can understand the progress that's happening. And specifically, even just the previous conversation, making this connection from the meeting that we had yesterday around this real need to have this point of coordination, particularly when it's not about diversion, it's about intervention before you even have to have a conversation about diversion. And seeing that embedded social worker within the police department could potentially play that role And I think part of the value of this type of transparency is not just about informing people, but it's about making those connections with, all the folks that are involved in this ecosystem that we're trying to build together. We don't all have all the right ideas up here on the dais. You are deeply, deeply, deeply in the work and don't always have enough time to even to pick your head up and look around. And so this is that opportunity for other folks that are paying attention to say, hey, I think there is another way that you could improve or augment what you're doing right now. And so that's why we hosted this. This is why we wanted this to happen. And we're also doing this because it's like we do need to keep the momentum going, because I mean, half of the team that I used to work for is here to speak on BCR. That work takes a long time. You do need actual 10-year plans, and you do need check-ins on those 10-year plans. Otherwise, they get dusty, and we don't know if we're actually advancing the work. And so I'm really grateful that Chair Chavez and Vice Chair Wansley created this venue to be able to actually start seeing some progress, because we've all felt very stuck in this universe of building comprehensive safety and being stuck in the slogans of both and. But now it's like we need to start unsticking ourselves to rhetoric and start maybe having more flow into action. And I think this is a perfect reflection of that. So I just really appreciate your work here.
Thank you. There is no one else on queue. So seeing no further questions, is there a motion
Yeah, I was going
to approve the amended legislative directive? So item 5.2, and receive and file that report?
Yes, I will move to motion the legislative directive for approval.
Second.
Thank you. Is there any discussion on that motion? Councilmember Palmisano.
Thank you, Madam Chair, and thank you, Director Harrington. I echo the sentiment of my colleagues on this update, and how I'm not sure if Dr. Oftelli, had he made it in, been able to given us a different presentation here. I also think that Director Harrington just gave us the report that you're asking for here. Am I wrong?
Councilmember Palmisano, is that a question for Vice Chair Wansley?
Sure. It's for the body, because there seems to be agreement on this legislative directive, and I'm just trying to get my bearings here because I've been left out of the conversation.
If Vice Chair Wansley would yield, I also see Council President Payne on queue.
Yes. So I will note also for the public record, because the agenda has been public for a couple of days now. So there has been a legislative directive attached to this item since last week. I can't control if council members check their inbox or not, but it's been there. In terms of what is amended right now before you, and again, how it gets us to more clarity around regular updates and understanding of the plan itself, it asks for a more elaborate overview of the launch list itself. As Director Harrington mentioned, she could be here all day on that item alone, and clearly we did not go through that process. So this legislative directive asks for that information as well. It also asks for the department leads that's charged with the implementation of the actions associated with each phase. And as I mentioned earlier, there's 3 phases. That was not provided today. And we know in conversations with staff, that's going to take time, and this legislative directive deadline is reflective of that time where we hope to receive that information. And then also, this is to capture any potential additional changes or removal of steps, and knowing that there's going to be conversations with our partners. So essentially, it does ask us to get additional information that we did not receive today.
Thank you. I do need to make a correction. This is a legislative directive I'm being asked to approve that I received at 11:46 a.m. today. This is a legislative directive that came in after the deadline. So I always ask if the affected department and our staff have seen, reviewed, and collaborated on legislative directives, and per an email from Assistant City Attorney Osborne, it appears that they have, so thank you for involving them in the process. The city attorney provided suggested revised language that respects the legislative and executive roles of our city, and so I guess I have a question for City Attorney Osborne, Mr. Chair. I'm curious if the city attorney could outline for us the concerns expressed in an email and ask if this revised language would be recommended per your concerns outlined in the email.
City Attorney Osborne.
Thank you, Mr. Chair. Councilmember Palmisano, I do believe the amended legislative directive gets at what I was most concerned about. And I sent and I apologize for the lateness of my email. I sent it this morning at 9 o'clock, but pardon my impertinence if it came across that way. But I just wanted to kind of remind the committee of a few first principles with the separation of powers and the legislative function versus the executive function. When I looked at the third item in the original legislative directive, it just sort of caught my attention, and I thought perhaps it could be viewed as, combining those in too much of a troubling way, and so I just pointed that out. The amended legislative directive, I think, gets at those concerns largely.
And can I add just clarification, because I do want to correct Councilmember Palmisano on the piece of, we were all at agenda setting. I know you weren't because you aren't on leadership for this committee, but we did talk with staff about this legislative directive, which was on the published agenda. And as any process with legislative directives, we know amendments and changes comes afterwards. And thank you, City Attorney, for mentioning that. We've been in ongoing conversations as of even this morning around what those changes could be. And this amended version is reflective of that. So thank you for providing that clarity, and I hope that answers your questions, Councilmember Palmisano.
Thank you. So have you, Councilmember Wansley, have you simply asked for this information, like outside of needing a legislative directive? Have we just asked the administration to come and provide regular updates? Then they asked for a legislative directive about it? I mean, we've just talked about the value of keeping the bigger picture in front of the public here in this work.
We'll go on to Vice Chair Wansley, and then we also have Council President Payne on queue.
Yeah. So, Councilmember Palmisano, I know you were aware because you were actually in leadership at that time that we do have a very clear policy that guides legislative directives that says if there's an item that requires more than 5 hours of administrative time, council should explore a legislative directive. This is reflective of, we know this is going to take more time, and I made that decision to pursue a legislative directive. What's your decision? If your actual clear questions aren't answered, you're more than welcome to not support it. But this, for me, felt like it was in alignment with our current policies. And I also value transparency. So me just asking the administration does nothing to clarify questions from my constituents about what is happening on this work, which is why we have committee, which is why we have legislative directives, so that that work can be done in the public and the public can see. So that is why this item is before you. Please feel free to support it. Also, feel free to not support it.
Councilmember Palmisano, I see you on queue.
Yes, but you've cut me off, so you wanted to go to Councilmember Payne. I'll just get back in queue for after he's done.
We'll continue with you, Councilmember Palmisano.
Mr. Chair, it's my understanding that any of us could reach out to Commissioner Barnett or Director Harrington at any time if we have questions about regular updates. And I have done this on many an occasion. I guess, to me, the fundamental difference of what it takes for a climate equity plan or a transportation action plan, comprehensive plans are different, they're governed by Met Council, versus something like this, is it feels as though, and I want to make sure that we're not, before I am willing to be supportive of this, I want to make sure that we're not taking into council's hands creating our own action plan and adopting it, right? Like, we're looking to take Dr. Oftelli's work and support it in every way possible. That's something I think we all agree on. What I am concerned about is this separation of powers, which the city attorney just said he didn't, excuse me, the city attorney has just indicated that he's generally supportive of this legislative directive from a separation of powers perspective. And so I get that. I guess I'm left a little bit confused at this 45-day comment period and what we're asking for feedback on. But it's my understanding that this revised language is what will be brought forward then to council. And yeah, I mean, I also just need to say routine disparagement and explaining of simple things should have no place on this body. And President Payne, I flagged this for our future conversations, but I don't appreciate blustery retorts and immediate put-downs every time I try and participate in these conversations. We each have equal representation on this body, and I deserve the respect of my office and positive intent, just as you all receive that from me. So I ask for us to have a larger discussion about the attitudes that are being shown on this dais in the near future. Thank you.
Thank you. Council President Payne, are you still on cue? And if we can just please keep it short, because we do have a presentation next, and I do want to be able to vote on this item. Thank you.
Yeah, I just want to flag, though, if we're talking about conversations to have around decorum and practices amongst this body, what we also should have a conversation is tone policing of Black women and women of color. I'm sorry if Councilmember Palmisano feels that me explaining her questions is a put down, but what I will not do is modify my tone because it makes you uncomfortable, or maybe, again, the information makes you uncomfortable to support things. But I do want to make sure we're addressing that dynamic, as we are also a council that is largely POC. And I also know between you and I, Councilmember Palmisano, want to make sure that tone policing, just making sure we all have a shared understanding of what it means to work under a diverse body and to be able to receive feedback from very diverse communication styles is also understood. But with that, I do recognize we have an important presentation from BCR and want to make sure we get to that. So again, we've already seconded my motion. If we could please call the roll on that.
I will ask the clerk to call the roll.
Councilmember Payne.
Aye.
Rainville is absent. Ellison is absent. Palmisano.
Aye.
Excuse me. Vice Chair Wansley.
Aye.
Chair Chavez.
Aye.
We have 4 ayes and 0 nays.
That motion carries and that report is received and filed. Our final item, which is item number 6, is receiving and filing a report from Canopy Roots on the Behavioral Crisis Response Team. I'll invite the entire BCR team up here just so you can present yourselves. Even if you're not speaking, it would just be great for us to know all your names. Thank you. And welcome. We're very excited to have you.
Hello, everyone. Before I get into it, I will let folks, did you mean everyone else? Chair Chavez? Okay, let folks introduce themselves, and then I'll come back. So, TCD and Carolyn, I believe that's directed towards y'all.
Afternoon, Taylor Crouch Dotson, Director of External Affairs at Canopy Roots.
Good afternoon, Council. Carolyn Bryant, contract consultant with Canopy Roots.
Clearly, I'm very short. Everyone had been down here. Hello, good afternoon, Chair Chavez, Vice Chair Wansley, and committee members. Seems like we came on a very lively day, and that the presentation fits very well with the other presentations that we have had the opportunity to hear today. My name is Gina O'Beary, and I'm the contract operations manager at Canopy Roots. Presenting with me today will be the Minneapolis Behavioral Crisis Response Program Manager, Marissa Stevenson, along with 2 guest speakers, Emma from the Canopy Roots Community Advisory Board, and Dean, one of our BCR responders who has been with us since the launch. And today, we're presenting our update on the BCR and its first year of 24/7 operations, which is super exciting. And we'll start by reintroducing our organization, Canopy Roots, and our approach to operating the BCR. And then we'll move into a review of a few key response highlights and learnings from this past year. We'll follow that with inviting our guest speakers to share how the BCR has impacted them both personally and professionally. And we'll close with what we see next for the BCR. So Canopy is made up of sister organizations, Canopy Mental Health and Consulting and Canopy Roots. Canopy MHC is a values-based mental health organization dedicated to serving BIPOC and historically marginalized communities through therapy and psychiatric services. Canopy Roots is an innovative mental health organization that provides unarmed mobile behavioral first response services and consultation and has operated the BCR since its launch in December 2021. Our values guide our approach to our work, both in the office and in the field. Canopy believes in centering the well-being of our employees to avoid burnout and help them be at their best when delivering services, because we know that none of us can pour from an empty cup. We encourage collaboration amongst each other and with those we serve, because like Chief O'Hara mentioned earlier, no one of us holds all the answers or perspectives to improve our complex systems. As much as possible, we want to support everyone's ability to self-determine their life and maintain their autonomy. We practice these values in our model of unarmed response services. We take an individualized approach to each interaction and consider the community, historical and political context, and our connections between each other when working with recipients and engaging with each other as professionals. This new branch of Minneapolis's public safety system helps to increase the public safety and health of residents by ensuring they get the support that is most appropriate for their needs, reducing police contact for communities that continue to have adverse experiences with law enforcement, sorry, turned too many pages. And creating efficiencies that help ensure officers are available to respond to issues most in line with their skill set. I'll now hand it over to Marissa to get into the BCR update.
Thank you, Gina. Good afternoon, Chair Chavez, Vice Chair Wansley, and the rest of the committee members. As many of you are familiar with the Behavioral Crisis Response, or the BCR, it's the city's newest independent first responder program providing culturally responsive, in-person de-escalation support and resources to people experiencing a mental health crisis. The teams are made up of mental health professionals and practitioners who respond in pairs, are unarmed, and are dispatched solely by 911 citywide. They use the same radios and computer-aided dispatch system as traditional first responders, which support safety, collaboration with our partners, and efficient field operations. BCR services are free and voluntary. We respond to calls, but do not force community members to interact with us. We don't bill insurance, and community members aren't billed for our services. This promotes the accessibility of BCR services and helps ensure that community members get the crisis support they need, regardless of their ability to pay. We'll now take a look at a few high-level performance measures from July 2023 through June 2024 and discuss successes and challenges from this past year. The end of June marks an exciting milestone for our program. We just completed our first full year of 24/7 operations. During this period, BCR has responded to over 10,300 incidents, and that's a 50% increase when compared to July 2022 through June 2023, increasing our average response to about 199 incidents per week. Between December of 2021 and June 2024, we've responded to over 20,500 calls. So the eligibility criteria, what types of incidents are eligible for a BCR response? So when a call comes in to 911, Minneapolis call takers gather essential details to assess which response or responses are appropriate for that situation. Incidents that involve a behavioral or mental health crisis where weapons are not involved, violence is not escalating or occurring, and no medical emergency exists, drugs and alcohol are not escalating the situation, are eligible for a BCR response. So let's see, how many 911 incidents receive a BCR response? When a call is answered by 911, it's given a problem nature code, or a PNC, as a 911 call taker listens to the details of the situation. The PNC may change for various reasons. Therefore, a call may be given many PNCs from beginning to the end of the incident. The last PNC given to a 911 incident is called the final PNC. This final PNC gives us the most relevant description of the incident and indicates which agencies were ultimately assigned. It's a helpful proxy for measuring the response rate of the various agencies. Where we see the monthly rates of two types of PNCs, BCR, Behavioral Crisis Response, and BCRW, Behavioral Crisis Response Welfare Check, and PIC stands for Person in Crisis. That type is a mental health crisis that requires police presence. This chart here is showing both a notable increase in BCR responses and a decline in police responses to mental health crises, and then moving into a 24/7 response. We're confident that this trend will continue as the BCR grows. So where are our teams responding? BCR operates citywide and has responded to every neighborhood in every ward. This heat map here shows the concentration of BCR responses by ward on the left and neighborhood on the right from June 2023 through June 2024. The darker shades of gray indicate a higher response volume. There is a heavy concentration in Precinct 1, downtown. BCR was designed to support anyone of any age, race, culture, or socioeconomic status. Anyone can call 911. We respond to unhoused individuals to downtown penthouse suites. How are incidents resolved? The majority of BCR calls are resolved by the responders providing de-escalation services and resources to people in crisis and their family members or friends. This slide here provides several examples of what that might look like on scene. We're going to provide trauma-informed emotional support to de-escalate recipients and family, psychoeducation. We assess for suicide and homicidal ideation. We use elements from multiple crisis intervention models. We look at things through a harm reduction lens, ways of reducing the level of harm related to substance use or self-harm. We do safety planning, crisis prevention, and then we do address basic needs when possible, such as food, shelter, and self-care supplies. And then we also connect folks to ongoing services. We do utilize the embedded social workers from time to time. We do have an internal way that we make referrals that way, and that's the same with COPE. So we have a strong preference for warm handoffs and direct connection, providing voluntary transportation to the recipient to a destination of their choosing for stability. High rates of calls resolved by transport is encouraged because we can avoid the criminalization or unnecessary hospitalization, which are both primary goals of the BCR program. As a reminder, we do not do any involuntary transportation, though we can partner with other agencies to advocate for a transport hold if that seems aligned with the needs of the community member. There's also other calls where the recipient may be gone by the time BCR arrives on the scene. This could be because they received support from the community members before we arrived, or they simply left the area. Successes and progress. This was a big year for us, and we're happy to share a number of developments since our last update. As mentioned earlier, we celebrated achieving a full year of 24/7 operations with 3 vans responding citywide. We are eagerly awaiting the delivery of 2 more vans, which will get us up to 5 total. I do hear that they should be ready shortly. We created and launched the Canopy Roots Community Advisory Board so that community perspective and feedback can continue to influence future iterations of the BCR. We've also been awarded a spot in the Harvard Government Performance Lab's Alternative Response Cohort, so we will be receiving technical assistance from the Harvard team to continue improving the program. Our team has been working diligently to increase community awareness of the BCR so that we can expand our reach and impact to all who live, work, and visit Minneapolis, as well as continue attracting a diverse workforce of BCR responders. This year, we've attended Pride, the Senior Fair, Juneteenth, Black Business Week, and look forward to participating in Open Streets. Lastly, collaboration is an essential part of our everyday work in the field. We continue to strengthen our relationships with our first responder colleagues who deliver high-quality services individually and together. We also prioritize building relationships with our with other community organizations and governments to grow the ecosystem of support that we can offer to recipients. And on that note, we'd like to express our appreciation to everyone we've had the pleasure of hosting for a site visit or a ride-along. Over this last year, we enjoy offering a behind-the-scenes look into the essential work of the BCR responders. Your active interest and support helps us sustain enthusiasm for the challenging and rewarding work of our team. So now I'd like to invite Emma and Dean to introduce themselves and share how the BCR has impacted them.
Welcome, Emma and Dean.
Good afternoon, council members. My name is Emma, and I am proud to be a member of the Canopy Roots Community Advisory Board. Growing up in a multiracial home in South Minneapolis, I learned from a young age the importance of being a positive force for change, and that real, lasting change comes from community leading the way. As someone living with PTSD, I also learned how crucial it is not only to be trauma-informed, but grounded in the humanity of the person in crisis. The Behavioral Crisis Response Team provides Minneapolis residents access to the person-centered, culturally responsive care they need. By providing unarmed, compassionate services through Canopy Roots and the BCR, the city helps ensure the unique needs of all residents are met. In fact, the BCR has supported my family in an emotional crisis situation. As my sister shared with me, reflecting on that experience, the BCR team supported us with compassion and understanding. And I lost my place, sorry about that. They supported us with compassion and counseling during our parents' mental health crisis. When they arrived, they swiftly de-escalated the situation, then collaborated with each of us to create a plan where we felt empowered to navigate the crisis moving forward. These experiences are what led me to join the Community Advisory Board, and I'm proud to be a vocal supporter of the BCR. By expanding this innovative service model, the distinct and unique needs of Minneapolis residents can be met with compassion and understanding by skilled professionals who are trained to handle these situations. Thank you for the opportunity to share my experiences with you, and thank you to Canopy Roots and the BCR for the critical work they do.
Thank you for being here. Hello.
Committee members, hello. Dean Zoller. I was lucky enough to be on the very first call the BCR ever did, me and Marissa and Amy, who is not here today, but just to see the growth and how far we've come from that day. And like the tiniest example would be is we were in a pantry across the street, we were in a mechanical room down the hall, to now having an office, and those are including 3 used vehicles that broke down almost weekly, to having 5 vans now. The support that we've got from the city and from every entity that is involved in the city, from you guys to the police to fire to EMS, it just shows how much we feel appreciated and valued as a co-responder, as the same as any other response from 911 services. I think this can only get bigger and better, and I've never heard a person complain about us being around first. It's the best job I've ever done. I can't imagine doing anything else, so I appreciate all the support that we've gotten from all of you guys. And if there's any questions, please feel free to ask.
Thank you for being here.
Thank you. Yep.
Thank you, Emma and Dean. We appreciate your willingness to share what the BCR means to you in this space. We hope that having them with their stories can help the council get a more comprehensive understanding about the work that we do. We've talked about some great progress that's been made, but we have more work to do to ensure that the BCR's place as a first responder in Minneapolis is cemented and the community can the community can rely on high-quality, consistent BCR services for many years to come. We now want to name a few challenges and opportunities that we've navigated over the past year. With the change of the city government structure and the transition of BCR to the Neighborhood Safety Department, there have been some growing pains. Lack of capacity within the department has presented challenges with data analysis. BCR previously had a dedicated data analyst from the city, and NSD does not yet have one for their programs. It's also been difficult to consistently meet with our contract manager when competing with the many demands that come with her role. We are excited to welcome the new BCR specialist to the NSD team and are optimistic that they will be able to smooth the transition. We also wanted to give some shout outs to Georgia Corsa, Katie Miller in Neighborhood Safety, Jen Gieselhardt and Director Hodney from MECC, Commander Waite with MPD, Scott Peterson from IT, and Tim Condon from the Digit team. They have been extremely supportive, so thank you so much. Since the Director, Nelson Brown, will no longer be our first point of contact, we do hope that the BCR specialist is provided with the organizational support and authority to move BCR matters forward quickly and effectively. The BCR has an ongoing need for a designated vehicle for supervisors. Without a dedicated vehicle for supervisors, operational efficiency is hindered. A designated vehicle would also alleviate reliance on loaner vehicles during van maintenance or downtime, simplifying the process. I believe everyone has felt the weight of the post-pandemic levels of inflation, and the BCR is no different. High inflation rates impact our ability to maintain competitive wages and keep up with the rising cost of supplies. We are mindful of remaining competitive relative to behavioral health and first responder careers. With the growth of mental health first responder field, all levels of policy reform must be prioritized to adapt to evolving public safety response needs between the BCR and traditional first responder agencies. Without this, the BCR will continue to run into barriers to optimal collaboration between partners, which impacts service delivery to recipients. Looking forward, so the future for the BCR, we're eager to partner with the city to address each of these challenges and opportunities. With that, we have a few asks from the council. One, we hope that you will work with Director Nelson Brown of Neighborhood Safety to allocate funding for the purchase and ongoing operation of a supervisor vehicle to add to the BCR fleet. She is currently working with city staff to obtain a cost estimate relating to this request. Two, we would like to partner with you to continue bringing awareness of the BCR at the local, state, and federal level so that the mental health first responder field can become equal with traditional first responders and children can grow up wanting to be a BCR responder. And three, the exploration into pay equity between mental health first responders and those from traditional agencies would help inform future funding allocations. To wrap things up, we want to acknowledge that the BCR has accepted an invite to the temporary Lake Street Community Safety Center so that the BCR is further woven into the fabric of the public safety system. We do want the public to be aware that this location is not a formal deployment site for the BCR and no walk-in services will be provided. You should continue to call 911 and request BCR services in a mental health emergency.
And with that, that concludes our 2024 updates on the Minneapolis Behavioral Crisis Response. Thank you for having us today, and thank you to our guest speakers for joining us. We know that the space can be intimidating, but we definitely appreciate their contributions because we feel that it helps to humanize the work and continue to show the impact. I did want to clarify one point from earlier that our Harvard Technical Assistance invitation is separate from the Harvard University team tied to Dr. Optelli. So those are two separate opportunities. And also there was a conversation about additional call types that could be eligible for a BCR response, and Canopy does have ideas for what some of those might be. We talked a bit about that with the team from the NYU Policing Project, and we'd be happy to continue engaging in that conversation with council and staff. And my colleagues and I will stand for questions.
Thank you, and thank you so much for that presentation and for coming down here to City Hall. We really appreciate it. And just for my colleagues, I have a monthly community safety meeting around Lake and Bloomington, monthly with my residents in the businesses and nonprofits in the area of the cultural district of Lake and Bloomington. And this past Monday, we obviously have report and updates from MPD, the Sheriff's Department, and the Hennepin County. And we also this time had an update, or we brought BCR, Mad Dads, and we also had LEAD. It's one of our public safety responses on Lake Street. And it was a really cool thing to have BCR in particular, so I just want to send my thank you to your staff for helping us be at that meeting, because it's a group of folks that speak Spanish, so we have interpreters in this meeting monthly, and many of them were like, I didn't know I could call 911 and potentially a mental health responder would be deployed, and that was just a really beautiful moment that I left very happy, because a lot of people in my community in that meeting were able to learn that a police officer doesn't have to respond to every call, and that we have mental health responders. We have BCR that's able to oftentimes in specific situations handle a situation a lot better. So I just want to start by saying thank you for that, and my residents were very appreciative of that meeting. So that was just a comment I want to make before I ask my questions, but I do have two questions. One, thanks for the presentation. I want to get a better understanding on how the city can better support this BCR contract we have. If you would love to hear your opinion on that. Chair Chavez, Vice Chair Wansley, committee members. I think that kind of what we were naming in the challenges, and that we heard a little bit about from other presenters today, is that NSD is developing and is experiencing a lack of capacity. So supporting NSD with building their capacity and allocating some of that capacity, additional capacity, I should say, to the BCR, especially as it relates to data analyst capabilities, along with, again, kind of empowering the new BCR specialists to be able to move issues forward, so that they can be resolved quickly and it doesn't negatively impact services that residents receive. Thank you. And then my last question, and it's looking at the recommendations or the council ask that you have, is one, allocate funding to Neighborhood Safety Department to purchase and operate BCR supervisor vehicles. Two, partner with Canopy to increase awareness of BCR via local community engagement and state and federal advocacy. And three, conduct pay equity analysis for mental health first responders compared to the traditional first responders. Would it be feasible to accomplish these various recommendations that you've listed and that I just read out loud for the public in the current contract period, which I believe ends August 2025?
Yes, that is correct. Chair Chavez, Vice Chair Wansley, committee members, yes, that is correct. Our contract period right now is set to expire in August 2025. As for our asks listed there, that first one, we do think that one could be pretty quickly completed if council is able to allocate the funding to NSD. That has been a need that has existed for a few years now, that we learned pretty soon after the launch of BCR that there are times where a team is out in the field and a supervisor, it would be beneficial for a supervisor to be able to respond in the field and support them on site. So that one we think could be accomplished, very soon. As for the other ones, those ones may take some more kind of longer term planning, like we were talking about earlier. And so far, each of our contracts has only been for 1 to 2 years. So we've been operating on a 1 to 2 year budget. And in order to prioritize some of those pieces to really solidify BCR's place and kind of the bigger picture of the mental health first responder field, we feel that perhaps a 10-year contract or somewhere longer, so that we could do some more kind of longer term projections for what those efforts might take, and help prevent I know there have been conversations too about folks getting nervous when we're getting too close to the contract expiration, but help there be some sustainability and consistency there for folks in Minneapolis as well.
And thanks for answering that question. My follow-up was going to be then, if not, then what would you suggest regarding timing? And that's something that this body can take for consideration and figure out like how we can help be supportive in that effort. So thank you for that. And then my last question, I going back to how the city can better support Canopy Roots, and specifically the council asks, I did have a question, and it was about allocating funding to NSC to purchase and operate BCRs. How much is that?
So we don't have an exact estimate right now. We have an estimate for the purchase of the vehicle, but there are additional costs associated with operating it, such as making sure that we have funds allocated for when it needs repair, that it can be replaced in whatever the city's kind of typical replacement period is, for fueling and things like that. So that one piece is kind of, we have that one from the neighborhood safety director, but we are still working on getting the other ones and to upfit the vehicle to make sure it has that laptop docking station and things like that.
Great, thank you. I'll just say if you all can follow up with my office about that, we'd love to figure out how we can be supportive, and I assume many people in this body and the council in general would love to figure out how we can be supportive, because these are critical action steps that I think can help improve, and we want to be supportive. So that's all for my questions. I'll pass it on to Council President Payne, then we have Councilmember Wansley, and then Councilmember Chowdhury, and it's Vice Chair Wansley, sorry. Council President Payne.
Thank you, Chair Chavez. I will just be forever grateful for everything that you do. And I say that not just because of the real world impact you're creating on the ground right now today. I'm just permanently grateful for that, but I'm grateful for the possibility that you represent. I think one of the hardest things when we were trying to start this program was people's just disbelief that it could possibly work. These kind of flippant comments about, what are you going to do, send a social worker to a bank robbery? And just people just could not envision anything other than police being a first responder. And you have basically created an entirely new world and a collective consciousness around what's actually possible about keeping our city safe. And so this is just the beginning of that vision. And I think that vision is now more tangible for so many more people because you're out there in the real world every day making that difference. And so I just had to say that out loud. But my question is very technical in nature. For the supervisor vehicle, do you need a kind of separate style of vehicle, or would your ideal outcome be another van that is dedicated for supervisor use but could be, put into service when you do have that backup need?
Chair Chavez, Vice Chair Wansley, Committee Member Payne, thank you for the question. I think ideally it would not be a van. I think it would be a regular sized vehicle, some type of suburban or SUV. Thank you.
Thank you.
Vice Chair Wansley.
Thank you, Chair Chavez. I just want to also echo just gratitude for you all's dedication to this work and your leadership in helping us build out alternative service when it comes to meeting the mental health needs of our residents. I'm just hearing Dean's comments too of literally knowing where you all have been in that office with that 1980s air conditioning contraption that was just so ghetto. And then now, and I would say at the pushing of council, and I'm really proud of council for our commitment in showing up and supporting and funding when there were gaps, as you highlighted, as we approach contracts from the administration, and we've had to show up and make sure contracts are ongoing. So I'm definitely noting of my interest amongst this body of how can we, especially in with NSD and the multiple growing pains we're experiencing when it comes to contract and contract management, what does it look like, which we're hearing from a number of providers, to show up in a more sustainable and long-term way when it comes to supporting our key safety alternative services. And it sounds like Director Harrington from her presentation is going to be working with New York University to also offer some support on that. I also heard very loud and clear, which came to the staffing study presentation as well, where we did have that evaluation support in NSD or OVP at a prior point to help us do that tracking. And I think that's been something that we've been advocating for a number of years, when many of you were still here on the city side. So I'm really interested in working with my colleagues as we're going into budget deliberations this time, and hearing from you all directly of your needs. That way we can hopefully be on the same page with OCS and NSD leadership around how we can both work together to support you all on some of the challenges that you've identified. But I particularly heard the contract piece, also the evaluation staff support, and that's going to be something I'm going to be committed to furthering along. But again, just thank you all so much, and for weathering the storms of working with the city of Minneapolis, especially when it comes to our public safety work, where, as you've seen even throughout today's conversation, there's growing pains in that aspect too, but you all have been with us through thick and thin, and just want to say thank you so much for showing up and continuing to show up, and most importantly, showing up for our residents who are most in need of this service.
And then we have Councilmember Chowdhury.
Thank you, Chair Chavez. This is not my typical committee. I'm actually not a member of this committee, but I had to come on down today to listen to your presentation and just get the opportunity to say thank you for all of the work that you put in every single day. Thank you to all the responders that are out there. I had an opportunity to join on a ride-along pretty recently. I got to meet and sit with the folks that were our responders and just have kind of like a table conversation until there was a call that came in, and folks really shared their stories of their professional background, but why they're in this role. And there was just a through line of deep care for our community, and a hope for more for people in our city. And I just have to uplift that we have incredible people that are doing this work. And I really felt that. I think I got to meet Dean that day as well. So it was really great to see you up here. And on that call, we got to visit with people in our community who I think really needed someone to show up for them, to feel supported, and were really struggling through some tough situations. And it was just transformational to see that up close, that you can pick up the phone in the city of Minneapolis, call for emergency, and get the right person to show up for you. And I've also been someone that's utilized the service, and I think just hearing from constituents and people in our city, it's a really positive thing to see the number of calls go up, which means that your capacity has grown. It shows that we should grow your capacity even more, and that it's becoming a household name, which is what we need, right? We need people to know that this type of emergency response is available, and it needs to become a part of the mainstream. I don't have any questions for you. I just wanted to give these comments and just share that I'm also interested, as a member of this council that's not a part of this body, to join in the efforts of connecting with our local, state, federal leaders in elevating behavioral crisis response and uplifting this type of response, and also participating in the work of looking at our policies and procedures, how we can budget and support your needs, so we can kind of reward the successes that we're seeing through more investment. So thank you so much for being here.
And then lastly, we have Councilmember Palmisano.
Thank you, Mr. Chair. I somehow have been knocked out of speaker management entirely, but I will assume it's a computer problem and not intentional.
Yeah, and I'll answer that because it's not intentional.
Thank you.
And I would never knock you out of speaker management, so to insinuate, it's just not true.
Thank you. That's why I assumed positive intent. I have two questions, but first, briefly, I wanted to add in how much I appreciate what I've been hearing from other first responders on scene when they are showing up with the behavioral crisis response team. It goes to Director Hodney's comments from earlier today about how you are a valued part of our response overall. I had two questions about your initial slides. The first is, you talked about the increase in response, and you have some great numbers to show for that. What do you credit to be about your increase in response? I was trying to discern that. from what you were saying, and I didn't know if it meant we're dispatching more calls to you, or if there's more staffing on your end, or if there are just more incidents that meet your criteria for being able to go alone on a BCR response.
Chair Chavez, Vice Chair Wansley, Council Member or Committee Member Palmisano, thank you for your question. So, looking at the midpoint in the graph, it lines up with June 2023, which is where we expanded to that full 24/7 operations. And before that, we were not able to respond at all hours of a day, every day per year. So that was kind of the big piece that we think that kind of big trajectory where it's going up is a large piece of that. I think that there are other factors that it can be hard, as we heard earlier, to kind of pull apart the exact reasons why a change has happened. I think another important factor is that more people are learning about the BCR, knowing that this is a service that is available to them. I know our External Affairs Department has been working very hard to attend community events, to work with city communications, and just make sure that all of our residents, everyone who works here or visits, knows that this is something that they have access to through 911. So that's a piece. I think that it's also kind of learning by doing. In the beginning, it took some getting used to for our 911 call takers and dispatchers to have a fourth option that they can send. And so now that it's becoming a little bit of second nature of knowing what types of calls are eligible for BCR, BCR giving feedback to 911 to say, these are other types of calls that we're interested in as well. Everybody kind of working together to, again, get more used to that collaboration and that getting more efficient. People getting to know each other between the different agencies and our BCR responders. So I do think that there are a number of reasons that contribute to that increase. And with knowing that was the day or the time that we increased to that 24/7 operating period, that feels like a large reason.
Thank you. I agree. From my own perspective, it feels like there's a lot of those reasons, with the 24/7 being an inflection point. I'm curious if you have a different, especially busy kind of crunch hour with police. In the past, they've reported to us that it's usually between 4 and 5 p.m., which is a little different than what myself or others might expect or typify. And just want to say that I think the positive experiences people have are really helping to grow these responses. It seemed like you maybe wanted to jump in and say something about when is your crunch time?
Sure, thank you. Chair Chavez, Vice Chair Wansley, Councilmember Palmisano. I would say the crunch time, it's kind of, I would say maybe between 11 a.m. and 7 p.m. It's pretty big.
It's a pretty big crunch time.
Yeah, yeah. I think, thinking about mental health and the nature of it, it's can happen anytime, right? And so that window seems to be when we're the busiest.
Thank you. Just briefly, because I know we're in a bit of a time crunch here. I was curious, you had a slide about how were incidents resolved, and I know that's sometimes difficult. I often wonder this, and have ended up a little bit frustrated in the past because there are times that additional interventions are needed from a behavioral crisis response team, but in my experience from our ward office, we have called through 911 to ask for BCR response, not for somebody that is clearly in crisis, but is perhaps homeless living in our community, and I can share the information that they are usually calmer at certain times of the day, and ask the BCR team to, as available, please respond. Then we've been able to say where, generally speaking, a person is is located, is sitting on a particular bench, and and that they are there consistently, routinely every single day, or they are going in and out of a lot of the small businesses in a consistent way to help guide the BCR team to that individual at a time that they are maybe a little more receptive for intervention. But the problem is we don't ever hear anything back. And I know that we're not asking for personal health information or anything like that. We're just trying to make sure that the behavioral health crisis response team has made successful contact with somebody. Is there a way to follow up with Canopy in that way?
Thanks for the question, Chair Chavez, Vice Chair Wansley, Councilmember Palmisano. You can reach out to me. I'd be happy to be in conversation about specific cases. I think the challenge with, especially unsheltered community members is that, it's not illegal, right, to be unsheltered and to not have a place to go. Sort of from a macro lens, there's a shortage of beds across the state. And sometimes shelters may not be safe for recipients. They might be, banned from certain shelters for various reasons. But, I can assure you that all 911 calls get a response from whether it's, EMS, MPD, BCR, fire, everything's going to get a response, animal control. So maybe we can chat on another time about that.
Sure, I'm happy to. And I just want to point out, I don't expect somebody to be transported. I fully appreciate the barriers and the challenges of everything that you just said. But I think being able to affirm to other concerned community members that are reaching out about these individuals, just want to know that the BCR team has made successful contact, knowing that it might take multiple contacts until even one of these unhoused community members would be willing to accept support. So I'll follow up with you individually. Thank you.
Thank you. No one else is on queue. Thank you so much for the update. You may proceed.
Sorry about that. Chair Chavez, Vice Chair Wansley, Councilmember Palmisano, I just wanted to add to Marissa's response because I do want to clarify for council and community that BCR is designed to be an emergency response service, so for acute situations, and right now does not have the capacity, does not offer or have the capacity for follow-up services and to kind of do that longer term kind of stabilization, I believe, if I'm using the right word. So BCR responders do make connections to COPE and to other community organizations for that piece. And so I just felt like it was important to clarify that part because there are a lot of folks who might need that service and don't want to set Marissa up to have lots of phone calls for folks that aren't going through 911 when someone is actively experiencing that emergency. And wanted to add that. And Dean actually had a piece that he wanted to add as well, so I wanted to give him the opportunity to provide that.
Welcome, Dean.
Committee members. So to answer your question a little bit more in depth, any person who calls 911 for any reason, whatever the emergency is, can request from dispatch, Joni, I think I'm also correct, for a disposition call afterwards. It doesn't necessarily mean that you're going to get a call every single time, but that's what you get to ask for, and if it lends credibility to, let's say, I didn't meet this person and they weren't where they were supposed to be at, I could at least call you back to tell you that, or I could call you back to say something. I can't give you any personal information. Obviously, I can't share anything like that, but we would never do that unless the call specifically states, because we get that normally with a lot of family members or case managers or something, and can you please let me know after the welfare check is done if he's there, if they were inside their place. So that would be one recommendation for people that you guys could all tell them. You have to ask dispatch for a disposition call afterwards.
Thank you, that's helpful too.
And one last piece is that our call takers and dispatchers, they are the ones who triage the calls coming in, and they decide which response or responses are most appropriate for the situation at hand. So BCR responders don't necessarily have a role in that piece. So yes, with that, I think we're done with that question.
Great. No one else is on queue. Oh,
One more.
Director, you may come up.
I'm sorry. Thank you, Chair Chavez, Councilmember Palmisano. I just want to add one clarification to what Dean said. I don't want the public to think that anybody can call in for that disposition code. It has to be the original person that called to get that information. So even when one of your constituents reaches out to you and asks you about something, one of you can't call to get that disposition. It has to be the original caller.
Thank you, Director Hodney. And if what would be helpful, at least for this body, is maybe you can set up a follow-up email to council about the actual process. That way we are able to communicate with some of our residents about how that works. I think that would be helpful. Thank you. Appreciate it. Cool. So nobody else is on queue. Any last minute stuff? Great. Awesome. Well, thank you so much for being here today. Really helpful presentation. We are really proud about all the work that you all are doing for our communities. It is really great stuff. So members, seeing that there are no further questions, I would direct the clerk to receive and file that report. And seeing no further business before us, I would declare this meeting adjourned. Thank you.
Thank you.